You are listening to the Horse Radio Network, part of the Equine Network family.
Hello and welcome to this episode of the Disease Du Jour podcast. I'm your host, Carly Sisson, and in this episode I talked with Dr. Elizabeth Acutt about acquiring quality radiographs in the field. The Disease Du Jour podcast is brought to you in 2024 by Merck Animal Health. Dr. Acutt obtained her veterinary degree from the University of Bristol in the United Kingdom. She then traveled to the University of California, Davis to undergo additional training in equine orthopedics and sports medicine. She was the first person to complete a residency specifically in equine diagnostic imaging based at Colorado State University. She became a diplomate of the American College of Veterinary Radiologists in 2022. She remained at CSU following her residency in the role of Senior Fellow in Veterinary Diagnostic Imaging. She is currently an assistant professor of clinical large animal diagnostic imaging at Penn Vet's New Bolton Center. Dr. Acutt's clinical and research interests focus on comparative imaging in the equine athlete. Thank you, Dr. Acutt, for joining us today.
Thanks so much for having me.
Can you get us started by explaining some common challenges associated with taking radiographs in the field compared to a clinic environment?
Definitely. So taking and interpreting radiographs on horses in the field is a totally different ballgame from doing it in a nice, controlled, clean, well-organized, well-equipped clinic. Sometimes I think taking radiographs in the field can feel like you're a wildlife photographer trying to get a picture of a snow leopard in a blizzard, and the situation's not ideal. The subject is not particularly cooperative, and there's definitely things that can conspire to make it feel like you're definitely facing an uphill struggle. I think the two main areas of challenge are in taking the radiographs, but then also in interpreting them. There's things that can make it challenging to do both of those things in the field. Things that make it hard to take the x-rays are firstly like a lack of ideal facilities. So you might be working in a barn with no power or lighting, maybe no even footing, without a dedicated space that you can work in. You might be even standing in mud in a field on the side of a hillside. So there's definitely things that can be difficult in terms of the setting. And then secondly, the personnel. You might be dealing with a lack of trained personnel. You might not have a dedicated technician to accompany you on all of your calls, particularly in an emergency situation. So you might have an owner who is perhaps elderly or incapacitated, doing their best to wrangle an unruly horse. So that can also definitely pose some challenges. I think also we have to be cognizant of the fact that when you're in the field, you're often on a time crunch. You might arrive at the appointment already running late, already with 15 more appointments that you have to get to. And so that pressure can feel quite real, I think, when you're trying to get those images. And then also, we're dealing with equipment, which, although it's been significantly improved in recent years, there are still some insufficiencies in portable equipment when we compare with hospital-based systems.
Yeah, so on the topic of equipment, can you run us through what you prefer to use in the field and maybe offer some recommendations for vets who are considering purchasing new equipment or upgrading what they're currently using?
Yeah, absolutely. I think the most important thing is just to find a system that makes sense for you and your specific needs. You need to find it easy and intuitive to use, and you need to be happy with the types of images that it produces. And so for this reason, I highly recommend talking with both the sales representatives for the systems that you're considering, and then also with other vets who are already using those systems in the field, just to kind of get an idea of what they're liking, challenges they're facing, and all that sort of thing. You want to look for systems that are lightweight, that are durable and user-friendly. And again, particularly those that have reliable technical support for when you run into difficulties. That's potentially going to be really helpful for troubleshooting issues. The kinds of barns that you work at. So that might be particularly relevant to how important it is to you to have a fully wireless system, for example. So if you work in a lot of barns that you're not always having ready access to power outlets, you don't always have dedicated spaces to work in, then having a fully wireless system might be really critical to your success. In terms of some more specifics, there are portable generators in general can either max out at 80 kVp or at 90. And I think now that we have these 90 kVp systems available, if possible, I think it's great to go for one of those just to get that extra bit of juice when you're trying to shoot through like a really chunky quarter horse stifle or the back of a really well-muscled warm blood. Getting that extra bit of power is going to be helpful. And then beyond that, the type of equipment really doesn't make that much of a difference. So that's when it kind of falls into your personal preference for the systems. And like I said, also in the types of images that they produce. So each system will have its own sort of algorithm for how it generates and manipulates and displays those images to you. And so personally, I am not a huge fan of the systems that have a high contrast algorithm, meaning that the differences in the radio opacities are really emphasized. Just because for me, I think that can highlight normal structures in a way that draws your eye to them and makes you think that you could be seeing an abnormality. So kind of normal bone margins look more like fractures. And so for me personally, I find those systems a little bit challenging to work with. And so I think that also emphasizes the importance of not only of the system, but also looking at the types of images that it generates and making sure that those are the kinds of images that you're going to want to be reviewing and interpreting.
Yeah, that's great advice. I'm sure it really depends on the type of clients that you're typically working with, any type of environments that you're typically in. Today's Disease Du Jour podcast is brought to you by Merck Animal Health. The maker of prestige vaccines, Banamine, flunixin-meglumine, Panacur, fenbendazole, Regimate, Eltrenagest, Protozel, 1.56% diclazaril, anti-protozoal pellets, and other trusted equine health solutions, Merck Animal Health works for you and for horses. Learn more about Merck Animal Health's comprehensive portfolio of products, as well as our unconditional investment in our industry, profession, and community through programs such as the Respiratory Biosurveillance Program and unique solutions like biothermo temperature sensing microchips. Visit MerckAnimalHealthUSA.com for more information. So I'd love to move now into talking a little bit more about some tips that you might have for taking quality radiographs in the field. I know it's going to be a little bit difficult to discuss without visuals, but any sort of general advice that you have or more specific advice for taking radiographs of some tricky parts of the horse would be great.
Yeah, absolutely. So just kind of, I guess, dovetailing from some equipment things, I think what can be really helpful, especially if you're going out in the field with a new system, is to make sure that you have access to the technique chart that they provide you with. So the technique chart, you might have a physical copy or it might be online, but it's just going to be a guideline of where to start with your techniques. So your KVP, your MA, and your exposure time for the various different body parts. So I think that's a really good starting point if you're not sure. Obviously, it varies a little bit dependent on the type of patient, but it just kind of gives a nice jumping off point. And then also just making sure before you go out there that you have, in addition to your digital radiography system, all of the other bits and pieces of equipment that you need. So thinking about for foot x-rays, how you're going to want to have some small wooden blocks that the horse can stand on, just so that you elevate those feet into the path of the beam sufficiently to look at the whole hoof capsule. Things like taking Play-Doh with you to pack the horse's feet. So horses will have, those deep sulci either side of the frog, which can basically hold gas within them so that when you take those x-rays, you kind of get these superimposed lucent regions, which can make it a little bit more challenging to interpret your foot films. And so making sure that you have Play-Doh with you to kind of smush into those spaces and fill them out makes a big difference for your foot films. Something else I think is helpful to have with you is a thin rope halter. And I use that for taking skull radiographs, just so that I don't have any bulky metal, the buckle, or anything within the halter that might be getting in the way of what I'm trying to look at on those skull films. Markers are really important. So I think we're all, pretty comfortable with using our markers to indicate laterality with our distal limb radiographs, but also particularly for the axial skeleton, so the neck and the back. Having markers that help you localize yourself can be really helpful when it comes to reviewing those images. And so what I mean by that is if you have markers, typically like little BBs or something like that, that are distinct from one another, and you place those along the region that you're imaging, and then you make sure that you take X-rays that overlap with each other, then those markers can help you figure out exactly which areas you're looking at. So whether that be an area of spinous process impingement that you want to fully localize, or perhaps arthritis in the neck. Sometimes if you're just looking at those X-rays in isolation, it can be hard to know exactly which area you're looking at. So using those markers to kind of orient yourself can be really helpful. My kind of biggest tip for, in general, distal limb X-rays is going to be, like I said, within the confines of what's available to you, having the horse standing on a flat, even surface, and also trying to have them stand as squarely as possible. So you'll find that if you have any slight asymmetry in how the horse is positioned, you'll have to try to compensate for that with your beam angle. And I think it's just easier in general to start from a place of straightness and symmetry as much as possible. And then you can make those slight adjustments to beam angle without having to sort of make big adjustments to account for a really crooked leg that's off to one side. Another point that can be helpful when you're taking images, and I find that this is particularly relevant when you're trying to get a lot of images done. So for example, maybe in a pre-purchase scenario, if possible, is to try and get it set up so that you can see your viewer from where you're taking the X-rays. And what that means is that in between shots, if you need to make a slight positioning adjustment, you can stay where you are. You can take the X-ray, you can look over, see how your positioning is, and then you can make that slight adjustment from where you were originally positioned. And I think that's easier than having to put the machine down, walk over to the imaging viewing system, see what changes you need to make, and then coming back and trying to remember where you were. So that's just a nice tip if you are able to set yourself up in that way. It could just kind of keep things moving quickly through those images. In terms of some more specific areas, I think just some common kind of pitfalls that I can go through that I see would be beginning with the fetlock joint. I think sometimes we struggle to see the joint space if the sesamoids are not elevated off of that joint space. And so the key to that is just making sure that you have enough of a downward angle on your DP projection and also on your oblique projection so that you elevate those sesamoids off of the joint space. Thinking about the carpus, I think carpal obliques, it's sometimes a bit challenging to know when you've got the right degree of obliquity. And so one just kind of easy tip to help you with those is that in both of your oblique views, so in the DL-PMO and the DM-PLO, you want to have the accessory carpal bone a third of the way superimposed with the rest of the carpus. So a third of that accessory carpal bone superimposed with the other bones of the carpus. So I think that's kind of just a nice guideline to have in the back of your head without having to worry too much about the specific angles, in terms of degrees that you should be aiming for. The stifle is a common area of struggle. It's just such a big area to visualize, and you can't really see the anatomy super well. And so some common pitfalls of stifle radiography are going to be underexposure. And often that is, partly just a function of the bulk of musculature that's there, but also not being close enough with your generator. So sometimes that can mean that, particularly with your caudocranial views, you're a matter of a few inches away from the horse's thigh muscles and the back of the horse's leg when you take that X-ray. And getting close is really going to be the key to improving your image when you've already maxed out your generator settings like we talked about. And then the other common problem with the caudocranial projection is having a tendency to angle downwards too much. So I think we kind of have that drilled into us that we put a downward angle on our caudocranial stifle views. And actually, often I find that the more horizontal I go, the better I am able to visualize the joint space. So I would say that if you're struggling with that, just try dropping your beam angle. And sometimes that can be enough to give you the image that you're looking for. Another way in which angle can be an issue with the stifles is when you're thinking about your oblique projection. And so a common problem is not being quite oblique enough to see those kind of key areas where pathology occurs. And so the correct angle for that view is 45 degrees. So you really just want to split the difference between your caudocranial and your lateral view, and that should give you the right amount of obliquity on that view. We already talked a little bit about the axial skeleton and kind of markers and how helpful they are. And this is another area where there's a lot of soft tissue surrounding those osseous structures. And so getting a good amount of penetration can sometimes be a struggle. And so some general tips for helping that is, firstly, get close, as we already talked about with the stifles. And then secondly, to collimate your beam. And so what collimation does is it just limits the aperture through which the X-rays can exit the machine, and that decreases our scatter of our X-rays and it improves our overall image quality. And I think sometimes people are a little bit nervous to collimate because they don't want to miss the area of interest. And so sometimes what I'll do is I'll actually open my collimation and have quite a wide field to start off with. And then I take my view, I figure out where I am. And then once I feel good about it, then I'm able to collimate down a little bit more and kind of zoom in on that area of interest and get a much higher resolution image of that particular area that I'm aiming for. Other things that you can do for the neck in particular, so getting the most caudal aspect of the neck can sometimes be a struggle. Again, there's a lot of bulk of musculature in that region. And so bringing one of the horse's legs back can actually help with removing some of that bulk of shoulder musculature out of the beam. And so if you have enough people, you can actually have someone physically lift the leg and retract it, or even just having the horses stand with their legs offset from one another can be enough to just kind of help you get that extra bit of penetration that you need in that region.
Would that be the leg on the side that you're X-raying or opposite?
That's a great question. Both can work. Usually it's, especially if you're going to have a person pull it back, it's usually easier to have them do that on the side that the X-ray is being taken rather than being kind of potentially in the way of the person holding the plate. But yeah, either way works. Other things that are helpful are also just kind of related to positioning of the horse, just being cognizant of the conformation of the individual horse that you're X-raying. And I think this is particularly pertinent for foot radiographs. So you can imagine that if you're trying to take a skyline view of the navicular bone, then the angle that you need to do that is going to be very different for like a boxy upright hoof versus maybe like a, flat-footed thoroughbred with some underrun heels. There's going to be quite a lot of variation. And so just kind of taking the time to actually look at the anatomy in front of you rather than sort of working from a standardized, I always take it at this angle. So factoring that in both in terms of how the horse is standing and also how its conformation is can just kind of help you to get the best views as well. My final thing, I guess, that I would talk about in terms of a specific body part would be for the skull, because this was a particular problem area for me for a while. I struggled with taking skull radiographs, and part of the challenge for me was that depending on, how sedated the horse's head could be in a very different position for those views, either straight out in front of it or nose pointed down at the floor. And so then that kind of introduced another plane of movement that was sort of difficult for me to contend with. And what has really helped me enormously for taking skull radiographs has been to just imagine the horse's head as a big cylinder from sort of pole to nose, and then to think that all of the oblique views that you're taking are going to be, the angle of those is going to be around the long axis of that cylinder. So dorsoventral does not necessarily now mean dorsoventral from a horizontal plane. It's dorsoventral relative to that long axis of the horse's head of that cylinder. And so I think that that's something that can help when you're kind of struggling to conceptualize all these different planes of movement.
Yeah, thank you. That was a really great overview of so many areas. Are there any horses that you won't image in the field or any parts of the body that you won't image in the field? At what point do you prefer to refer horses to a clinic?
So again, it's sort of similar to some of the things we've already discussed, where due to the limits of the portable generators, there are just some areas of the horse that are too large for us to image satisfactorily in the field. So things like the pelvis, the coxofemoral joint, the lumbar spine, the thorax, the abdomen, they can be almost impossible to get diagnostic radiographs in the field other than perhaps in a foal or a very small patient. And many of those regions even pose a radiographic challenge in the clinic, just given the sheer size of some adult horses. And so many of these areas are actually best imaged by ultrasound instead. So whether that ultrasound is performed in the field or at a specialty clinic is also kind of open to interpretation and is going to be determined a little bit, again, by the limits of your portable ultrasound equipment. And then also just your personal comfort and experience level with doing these ultrasound exams, which can be quite challenging. Oftentimes, these aren't sort of our basic day one ultrasound exams. You know, things like the coxofemoral joint can be quite challenging. And so that might also determine whether a primary care veterinarian feels comfortable performing those in the field or sending the horse in for advanced imaging, whether that be X-rays, ultrasound in a clinic, or even, you know, more advanced imaging like MRI or CT or something.
Yeah, and also you mentioned that sometimes the barn environments can be challenging. So how much do you try to make the barn environment work versus just saying, you know, this is too challenging and we're going to go into a more, you know, professional, clean environment?
That's a really good question. And I think that it's something that is, I think more and more veterinarians are starting to see the benefit of call-in appointments and having a clinic that they work out of and having people come to them. And I think more and more owners are feeling comfortable with the idea of potentially having to go into a clinic to have the exam performed to the highest standard. So I think that's really sort of an individual circumstances judgment. It might depend, like you say, on the specific facilities. I mean, a great example would be if you have a system where you need to be able to plug in either your generator or your system and there's no power outlets in the barn, then, you know, that's a very easy determination that you know, something about the environment needs to change. Other times it might be, you know, just perhaps you are struggling to, it's maybe like a difficult horse, for example, that is, you know, maybe you're trying to get stifle films and every time you slide the plate up there, the horse is kicking and the owner doesn't feel comfortable perhaps with restraining the horse, but you might not have, you know, the technical support. So that might be another one where you say, you know, we just need to try this again with new people or in a different environment or something like that. So I think it is a little bit up to your individual determination of the situation. And then also, you know, the resources that you have available to you regionally. So many vets may not have a haul-in clinic option. The nearest referral center might be, you know, a few hours away. So, and that's a tough situation, you know, because then there is a little bit more pressure of we have to get this done here because not getting it done here necessitates much more of a procedure and a more administration. So I think it's a tough one to answer because it's so variable depending on each unique situation.
Do you have anything else you'd like to add on the topic before we wrap up?
The only other thing that I wanted to talk about, I guess I mentioned at the start of this, was the image interpretation part of it as well, because I think we often focus on how to get those radiographs in the field, and sometimes we overlook how to interpret them in the field. And, you know, sometimes interpreting radiographs in the field means kind of trying to use your body to shade the glare from, you know, the overhead sun, and you have an emotional owner who's like peering over your shoulder and really wants that immediate diagnosis of what's going on. And, you know, that can be really tough, especially because you also can feel quite isolated in that scenario. You know, you might not have easy access to resources to be able to just look something up. You also might not have easy access to other images, either perhaps from different patients. You know, if you want to compare, you think, oh gosh, I wonder if that, you know, I do this all the time, especially if I'm kind of looking for a fracture, I'm like, is that line always there? And then I go back to the last 3 horses that I imaged and I think, oh yeah, it's there in all of them. I just never noticed it before. So you don't have that opportunity always when you're in that barn setting. And then also, you know, to compare to that particular horse's previous x-rays as well. Maybe, you know, if you're trying to say, oh, is this laminitis better or worse? And you can't easily pull up the previous films. So I think the interpretation can be really challenging. And I think just kind of not being afraid to say, you know what, I'm going to have to take a look at these once I get back to the clinic. I think you can sometimes feel very pressured into giving an immediate answer in non-ideal conditions. And so I think just kind of having the confidence to kind of say, you know what, this is what my initial impression is, whether that be, I don't see anything major, but I'm going to have to go back and sit in a dark room. And, you can kind of blame the conditions or whatever you need to kind of just buy yourself some time. And then, of course, there's always the option to send out to a radiologist. So if you're really not sure of what you're looking at, then, telling the owner, I think we need a second opinion on these is becoming more and more commonplace. Many people routinely send their studies to radiologists for interpretation these days, especially things like pre-purchases, where the stakes can be quite high. So just kind of knowing that you have those resources available to you is also helpful.
Yeah, I think that's great advice. This has been a really helpful overview. So thank you so much, Dr. Acutt, for joining us today. And thank you to our audience for listening. And a very special thank you to our sponsor, Merck Animal Health. If you have any questions or suggestions for the podcast, please send me an email at csisson@equinenetwork.com. That's CSISSON@equinenetwork.com.